So it is October 28th, 2011. And we're in Mill Valley, and I'm talking to Dr. Marty Rossman, who I've known for 38 years, 1974, whatever that is.
Yeah, that's about right.
38 years.
Yeah.
I came over to Stinson Beach when I was snooping around the area to decide if I wanted to do my wellness center in Mill Valley
Oh,
or
is that
Santa
right?
Cruz. And I saw you in Irving in your office. Remember, you were wearing a white coat and looking very.
Was it in Bolinas or Stinson
I
Beach?
thought it was Stinson.
Stinson Beach above the grocery store?
I don't remember.
Yeah. My first office was above
Yeah.
what was Ed's Super Rat at Stinson Beach
Okay.
at that time.
I just remember it was.
But if Irving was there, it probably was in Bolinas.
Well, it could have been. I
In
went over to
back
see
of the
Mike
Presbyterian
Samuels.
church.
Okay.
Little clinic in back of the.
Well, so much for memory. I thought it was
Well, it's
Stinson.
close enough.
But why I would like to interview you today is those of us old farts who are now, reaching the height of our career. What led us to do this, and I don't really know where you were born, how you decided to become a doctor, how you got out of
all
the
the way
basic
back to
stuff.
that.
Yeah, I decided to be a doctor when I was 5. How about
Did you? I didn't decide to be a doctor when I was 5. I think my family pointed me towards being a professional.
Uh-huh.
But originally, like when I was about 12, I was interested in being a veterinarian.
Mm-hmm.
And I spent some time at a veterinarian's office. I went and kind of volunteered to see sometime in the summer to see
Mhm.
what that was like.
Now, where is this? Where'd you grow up?
Outside of Detroit,
Okay.
Oak Park, Michigan,
Okay.
a suburb of Detroit,
Uh-huh.
where I grew up. And this guy was the most stressed out guy I'd ever seen in my life. And we actually I've always been interested in how, what makes people tick and how
Uh-huh.
people work and what this is all about and how we fit into this whole thing. But so I've always been a good listener. So I asked him one day why he was so stressed out. He seemed to be really stressed out, and he said, I love the animals, but these people are driving me crazy. And when I heard that, I thought, well, if the people are going to drive you crazy, you might as well be a doctor. There's no,
Maybe you can fix their craziness.
there's no reason to get away from the vet. And then I went through a short period where I thought maybe it'd be a dentist. My father always encouraged me to be a professional.
Uh-huh.
He was a blue collar guy, and then he had a retail Army Navy surplus store.
Mm-hmm.
So steady, hard working guy. But he thought it would be great to be a health professional,
Mhm.
and that was a big value in Jewish communities. So I had an older cousin who was a very well respected doctor, and he'd gone to Michigan,
Mhm.
and that was sort of the top
Mhm.
thing that you could imagine. So
Right.
so I went to Michigan. I wasn't a good student, but I was always pretty close to being the smartest guy in the class.
Michigan is
University of Michigan.
okay, because
Ann
Michigan
Arbor.
State is also, what do they call
No.
that?
What do they call that?
Yeah, like, is there a distinction in Michigan? I grew up in Ohio, so
Yeah, well, the university, we think we're better than them.
I know that.
And they
Yeah.
try to make,
Except for Ohio State.
that's
beats your ass.
basically it. Yeah, but the state school, the university was the more prestigious school.
Yeah.
Michigan State was mainly known as an agricultural school,
Oh.
but they now have a medical school.
Hmm.
It's an osteopathic medical school, and they've graduated like 4,000 people. When I grew up, the MDs and DOs really hated each other. And
Yeah,
there was
me
and the MDs really disrespected the DOs and chiropractors, and it was
Mhm.
a very intense turf war. And there's
Mm-hmm.
less of it now, but because the DOs sort of sold out in California,
Well,
and they've come together in certain
Yeah.
ways. And most of the DOs practice like MDs now. But
Yeah.
anyhow, there was no other medical school. But even when I went to Michigan, I didn't know I was going to go to medical school. I did
Mhm.
pre-med.
Mm-hmm.
Dentistry looked boring and kind of repetitive to me, and I thought I would probably be a psychiatrist. That really
Mhm.
interested me. Things like religion, philosophy,
Mhm.
and psychology interested me. So when I graduated there, I had been out to California a few times during the summer. I visited
Mhm.
San Francisco, probably in 65 and maybe 67 in the summer of love.
Mm-hmm.
And so everything was happening here, and it was so beautiful, and
Mm.
there was,
Yeah.
the music and the sexual revolution and all the political changes, and the free speech movement really attracted me, and the free clinic movement attracted me.
So you would have been midway through med school in '67?
Yeah, so I was looking at places. So I thought, I'm going to come out here and do my internship.
Uh-huh. Now, did you do med school at Michigan also?
At Michigan, yeah.
Uh-huh.
Yeah, I went in after 3 years of undergraduate.
Oh, okay. So you got a jump on the...
Yeah. So when I got out, I got an internship, which turned out to be in Oakland at Highland Alameda County Hospital.
Oh,
which is
did you
the
know
county
Steve
hospital.
Colucci? He
No.
was the year... He was...
What year would he have been?
He was the... We were there 69, 70, because I did a month at Highland. I was at the Public Health Service Hospital
Oh,
on
right.
15th and Lake.
Well,
and,
we were there, we overlapped. We were at
Yeah.
the same time.
well, interesting. So,
And
and Lynn Saputo was there too.
Len Saputo, who's a very good friend
Yeah.
of mine now, he was the chief resident. He was
Yeah.
the chief resident and a really good doc, always a really good doc. And, Len came to me maybe 15 years ago when he decided to kind of turn holistic, and he
Mm-hmm.
said he thought we were doing the right thing
Yeah.
now, and he didn't see it before, and he's full on to it.
Yeah, I
He's done a
met
lot of
up
great-
with him last month.
Yeah,
First
he's
time
doing.
I never actually met him.
He's really passionate and very
Mhm.
committed. My hat's off to him.
So then you
yeah.
finished med school and you interned Highland.
At Highland. And my thing by the end of medical school, I was interested in psychiatry, but when I looked at psychiatry programs back then, this is 1969, so they were one of two kinds. They were either very psychoanalytically oriented, which even if it was the best way to do therapy with people,
Mhm.
which I don't think it is anymore. I think there's some great insights from it,
Mhm.
and we've learned a lot from it, but even if it was the best way to do therapy, this was 1969, and I had been involved with the civil rights movement, and civil rights was always really important to me.
Mhm.
I was always very disappointed with the racial tension and division back in
In
Detroit.
Detroit, yeah.
And so that was really important to me. So I was going to bring like high class medicine to the disadvantaged. So
Mm.
Oakland was really perfect for
Sure.
me because it was kind of like Detroit across the bay from San Francisco. I was very
Doesn't get any
familiar
better than that.
with it, in a way. So when I was the other kind of psychiatric residency was biological, which is basically
Yeah.
drug oriented,
Yeah.
which is also very interesting, fascinating, still is to me, but it's not something I would want to do on
Mhm.
a full-time basis.
Mhm.
So I decided I'd do a general internship and I would practice for a while and see what the real practice of medicine was
Mhm.
like. And then if that led me somewhere, great. So at the end of my internship, I worked part-time at the county clinic at Highland. And I did some emergency room work, and then I volunteered in a number of free clinics. And about a year after, I actually became the medical director of the George Jackson Free Clinic,
Mm.
which in the Black Panther Free Clinic
Mhm.
in Oakland on Shattuck. Did that for
Mm.
a couple of years. And did a house call practice in East Oakland.
House call.
Yeah, because I was seeing all these people with chronic illnesses in
Yeah.
the clinic. This is how I got into holistic medicine. Is
Mhm.
seeing all these 300-pound diabetics eating donuts all day, and
Mhm.
chronic lung disease patients who are smoking 3 packs of cigarettes a day, and the coronary patients who are eating pork rinds and sitting in the
Mhm.
lounge chair. And what we call the diseases of civilization, and where the main thing, as so you'd see all these patients, and I'd have very good relations with them. I'd go out of my way. I mean, that was
Mhm.
really important to me. I always thought that was the matrix by which you can help somebody change. But basically, they were coming in with big bags of medicine, shopping bags of medicines,
Mhm.
and I'd either give them more medicines, or I'd take them off some medicines, or I'd give them medicines to counteract the side effects of the other medicines, or and then they would feel better for a while.
Mhm.
If I gave them something or took them off something, usually, the next time I'd see them in about 6 weeks, they'd be feeling better.
Mhm.
Then the next time I'd see them, they'd be feeling worse. And then I would have to either take them off something or put them on something.
Mhm.
And it seemed to me it was sort of the dance of chronic illness, and I never felt
Teeter-totter.
like I was ever really getting to something that really affected
Mhm.
people's lives. So So that's where the house call practice came from. I wanted to see why it's so hard to get people to change.
Mm-hmm.
And that's still kind of the core
Mm-hmm.
question in my practice. And I'm probably better at most in helping to get people to change, but it's very, very,
Yeah.
very, very, very difficult. So I was in my clinic one day, this was after a couple of years of practice, and I was burning out, basically. I was seeing all these people, I was working really hard, trying to help them change the way they ate or lived or smoked or drank or whatever. It seemed like they were working like 5 times as hard to kill themselves while I'm working
Yeah.
my rear end off to try to help them. That's what it seemed to me as a young doctor.
Yeah.
And so there were so many failure experiences. The way that I looked at it then, I wouldn't look at it that way, but it was draining. I got very depressed. I came and I was in my clinic one day after maybe 5 or 6 patient encounters where I'd felt like I didn't really do anything of value. And literally, and this is before I got introduced to guided to imagery, but literally a theater marquee went on in my head with lights and everything. Seriously. And it said, find something else to do.
Wow.
And I thought, this is not a subtle message. I was not foreign to getting messages from my unconscious, but it had never been quite that clear.
That dramatic, huh?
And it was instantaneously clear to me that I could not, I was probably 26, 27, that I couldn't spend the rest of my life doing that. Just, I couldn't even imagine doing that. I had to find something else to do. I knew it was right as soon as it came. I didn't even know if it would be in medicine. I wasn't, I was single. I wasn't bought into anything. I was open to anything. Didn't have the faintest idea what that might be. The very next day, in our medical staff meeting, our chief of medicine comes in. He says, we're supposed to talk about hypertension today, but you guys have to see this. And he puts a videotape in the videotape player.
Herb Benson, I bet.
No, it was the videotape that the AMA made on their first visit to China in 1971. Bringing back videotapes of people having major operations with just acupuncture needles for anesthesia. Nobody had ever heard of acupuncture. And here's this, he shows us this high quality videotape of a man laying on an operating table from the head down, little screen between him and the surgeons. Surgeons they're doing a pulmonary lobectomy. They're taking out part of his lung. They're cutting his ribs with a rib cutter, which, as you know, looks like a big bolt cutter. They're lifting out a section of his lung out of his chest. He's talking to the nurses, and they're feeding him. You've probably seen this.
Yeah.
They're feeding him sections of mandarin oranges and sips of tea, and talking to him. And the top of my head just about came up. I thought, what is that? And there were so many synchronicities. At the end of the operation, they bandage him up. He sits up. He puts an arm around each surgeon, walks out of the operating room. They kind of polite applause. The only anesthesia he had was 4 acupuncture needles.
Just 4?
4 needles.
Wow.
So one of the synchronicities in this, besides the fact that it was made by this blue ribbon panel of the AMA, I think they were all men. They were all presidents of universities, deans of the medical school. Franz Ingelfinger, the 40-year editor of the New England Journal of Medicine. These are highly, Paul Dudley White and DeBakey and people, really respectable people that you have to look up to, whatever your medicine is. People had spent 40, 50 years in medicine, so there wasn't a bunch of hippies they sent over there to see this thing. And the leader of the delegation, was one of my very few medical heroes. There's a guy named Sam Rosen. He was a professor of ENT at Columbia. And the reason he was one of my medical heroes is he invented this operation where they replaced the stapes in the ear for people where it's kind of gotten ossified into a bone. So he came to Michigan. He's got a 70-year-old deaf guy on the table. He's in his ear with this little micro thing. He puts his little prosthesis in there, and he says to the guy, "Can you hear me?" This guy jumps up. And I've often thought, John, you know, the fantasy, at least for me as a young doctor, is somebody comes in with a problem. I diagnose it. I prescribe or administer a treatment. They get better.
Mm-hmm.
They're happy. I'm happy. That's the fantasy of medicine, you know. And
The occasional reward.
it happens in emergency room medicine.
Mhm.
It happens once in a while. In acute care medicine, it happens. But when you're dealing with people with chronic illnesses,
Doesn't
that
happen.
never happens. Almost never. So I thought, wow, this guy really did something in medicine that's changing people's lives. So he was a hero of mine. So he's the head of the delegation. And at the end of this videotape, he looks right into the camera, full face. He says, "We saw 100 of these operations. We think that it's a real phenomenon. We don't understand what's going on, but it needs to be seriously investigated. And the sooner the better." So I took that as my marching orders. You know, I thought, thank you. You know, it's like, here's this thing.
Mm-hmm.
They came out of the blue, as you know, and I always refer to it as like the crack in my cosmic egg.
Right, right.
And it just, and I was able to locate the first major research project on acupuncture to be done in this country, which happened to be being done almost exactly between where I grew up and University of Michigan, about 20 miles from my home and 20 miles from the University of Michigan, back in Michigan. They were two Chinese doctors who'd become psychiatrists here and who had they'd fled the Cultural Revolution in China. They were MDs there. They got their MD here. They went into pain research, and they were working for a pharmaceutical company, Park Davis, in the basement of a mental hospital. And they said, "Hey, we're pain researchers. Acupuncture's big news. We know a little bit about acupuncture," and they knew a little bit is right. And they still had connections in China, and they got this little Chinese electrostimulator smuggled out to them. You couldn't get them anywhere. And they literally carried it around with them. They would not, it would never, ever leave their possession. And but they're really good guys, and I volunteered, so I got to examine chronic pain patients coming in, and while they were being treated, and when they went out and make assessments. And they were doing a very crude kind of acupuncture, and they were treating patients that were rejects from Mayo Clinic, University of Michigan, Cleveland Clinic, Case Western Reserve, end-of-the-line chronic, intractable chronic pain patients. The kind of patients, I mean, these people not only had heavy drug addictions, you know, multiple nerve blocks, multiple surgeries. We had one patient who came from the Mayo Clinic who'd had part of his spinal cord cut to sever the nerves that are supposed to carry his pain with no change in the pain. So they were the kind of patients that if you'd helped any one of them, you could have written it up for a journal. If you helped 10% of them, it'd be a mind blow. And by the time they wrote their data up after about 3 years, they helped about 40 to 45% of these people significantly. And I got to see with my own eyes, with my own hands, you know, these people coming in who you literally people would come in with post-herpetic neuralgia, and they were the classic patient that a shirt was too painful to put on, you know, and you could come within 3 inches and they'd feel your hand. And then they'd have 3 or 4 acupuncture treatments, and then I could push them and, you know, how you doing, pat them on the back.
You said post-herpetic. I don't know that term. Is that
Post-herpetic neuralgia is after shingles,
after shingles?
zoster,
Okay, I
after
figured
a
that.
zoster infection. It can be terrible, and it can last for a long time. So I saw there, spent a few months there, I saw that acupuncture was a real thing. Then I started to study it. And then that got me into the study of traditional Chinese medicine theory, which, as you know, is like almost like every pre-modern system of medicine is a holistic system. It doesn't separate mind, body, spirit. It looks at them as aspects of a unified energy, and that really opened me up. And then that led me into contact with Irving Oil and Bolinas, who you know.
I don't know him other than
Oh, you didn't
met
know
him. I met him
You only
that
met
day,
him there.
and I
Oh, you didn't
knew
know
his book.
Irving?
No.
Fabulous.
How did you? Little. He's dead now, isn't he?
Irving died about 20 years ago.
Yeah. So a little thumbnail of who he was.
So Irving Oil was a retired GP from New York. He was a genius. He was really the smartest guy I've ever met.
Really?
And he was a genius visionary, and with a gift of gab and a great sense of humor and a big perspective. And he had retired to Bolinas, and after giving up his general practice and getting really interested in things like initially Jungian psychology, and then had been on a trip. Who was that with? It might come to me. He'd been on a trip with Stanley Krippner and a bunch of people from a think tank that was looking into things like psychokinesis, the ability of people to move objects at a
I
distance.
remember that in the 70s.
ESP, the ability to know things at a distance. And there was a huge amount of Russian, Czechoslovakian research on this behind the Iron Curtain. And I think it was Stanley Krippner, I don't know the organization, but they did a tour behind the Iron Curtain to visit all these people that were doing this kind of wild research. And they also met a lot of people doing biofeedback, which was brand new at that time. They were looking at acupuncture as an energetic medicine. I mean, this stuff was really considered to be woo-woo stuff, but Irving was taking it very seriously and had looked into it pretty deeply, and it made a lot of sense to him that everything was energy. It made a lot of sense to him that we create our personal reality by his. He was too much of a solipsist for me eventually, because he was really fascinated by the idea that we literally create our whole reality. We project it, we don't perceive it. And so that the power of one's mind and the power of one's perceptions and being able to observe one's perceptions and images and change all that.
The law of attraction is the latest version of that.
Yeah, exactly. And I won't get into that. I think there's tremendous power in it, and to a great degree he's right. I don't agree that we create the whole thing. I think there's a big energy soup out there onto which we project this thing.
Yeah.
And sometimes the soup is moving us in directions that we didn't choose, and sometimes you get to choose and sometimes you don't get to choose.
You always get to choose how you respond.
You get to always choose how you respond, which is sometimes very difficult, but that's the one choice they can't take away from you. So Irving was into all that stuff, and he started a little clinic in Bolinas, and there was an oil spill back in, I think, 71. And there were a lot of volunteer workers that came out to clean up the oil spill, and clean the birds, and clean the beaches. And Irving and another retired doc named John Doss, and I think Michael Samuels, who you know, started this little volunteer clinic to treat the volunteers that were cleaning up the oil spill. And then it turned out they all had a lot of interests together, like the mind-body stuff, and what was the power of the mind, and is it all energy, and what is acupuncture about, and all that kind of, and things now that we don't take for granted, but are certainly more integrated, yoga and massage and nutrition. You wouldn't think those are far-out things, but back then
it was pretty radical.
So they started a little clinic that was open a few hours a day. And a friend of mine who was a conscientious objector was doing his alternate service out there. He was doing his community service. And he told my friend, you got to come out and see this guy. They're doing all kinds of they're doing hypnosis, and they're doing biofeedback and acupuncture and this, that, and the other thing. So I went out one day and met Irving, and he just absolutely blew my mind. He was just the most persuasive person that I'd ever met, and he wasn't afraid of an argument, and he enjoyed it, and he was able to respond to it. And basically, I played his devil's advocate for about 3.5 years till I finally gave up and decided he's absolutely right about I kept trying to, what's wrong with this picture? What's wrong with these? Why are these people coming in, with asthma, with a long history of chronic asthma,
Uh-huh.
and they come into the room and we apply an ultrasound machine to, we called it sonopuncture. We did the first research paper on that in the world. We apply an ultrasound machine to 6 acupuncture points, and we have him go inside and let an image come for his asthma.
Mm-hmm.
And we encourage him to dialogue with it and negotiate with it and make a deal. And his asthma goes away. I'd
Mhm.
never seen asthma ever go away,
Mm-hmm.
you know. And things like that were happening on a pretty routine basis out there. So we'd see patients together.
Now, what are the dates
This is
on
72. I moved to Bolinas in 7. I met him in 71. I moved out there New Year's Day in 72.
Mm-hmm.
We worked in that clinic together for about 2.5 years. Then I opened my little
Mhm.
private practice in Stinson Beach.
Yeah,
And
because
then-
I would have seen you in July of '74, so that was about.
So that
within
must have been in
2 years.
Bolinas.
Yeah, yeah.
Mike Samuels had worked with Irving before,
Mhm.
and he had left the clinic to write his first book.
And that
Seeing
was
the
what
Mind's Eye.
influenced me. Oh no, it was Well Body Book was.
Oh
What,
no, the Well Body
yeah,
book. I'm sorry, he was.
That
That's
was
right.
one of my major
Yeah,
transitions, and I
exactly.
went over to see him after I saw you. I went over to his house and
Yeah.
met him and Nancy, and
Right.
then. Well, we've only got about 15 minutes and
All
a
right.
lot further to go.
All
So
right,
from
well,
there,
it's fun
then,
to talk to you about this. But
yeah, it's great. So from there, you had your own clinic in Stinson.
Own clinic in Stinson for a while. Lived out in West Marin for a while. Why did I move over the hill?
Because the next time I saw you were at the houseboat, right? With
Well, I had moved. Actually, we had a group of about 24 docs who had all gotten interested in acupuncture at the same time.
uh-huh.
Acupuncture really, really fascinated me, and it worked well for me. It always worked. It worked right from the beginning when I knew nothing. It worked well for
Mhm.
me, and 40 years later continues to work well for
Mhm.
me. So we had a group of about 24 docs who'd all gotten interested in it early on. Joe Helms, Hal Balin,
Hal was at the houseboat. That's
Hal was
where I
at the
met
houseboat.
him. Yeah.
and we got together probably monthly for several years, and we
Mhm.
shared what we had learned from different teachers, and we went and visited each other's practices because we all thought like we must be going nuts. It was just it was too much. It was too much cognitive dissonance. Like
Yeah.
how come I went to one of the best medical schools in the United States and never heard the word,
Yeah.
and yet it's been around for 5 or 10,000 years,
Yeah.
and you can do major surgery with it. And what's wrong with Are we deluding ourselves somehow? But everybody was having the same kind of responses.
Mm-hmm.
So we were group support, sharing our knowledge, sharing our different
Mhm.
teachers. Some people had gone to England, some went to France, some went to Japan, some went to Hong Kong, Taiwan, learning from local doctors. And I met Hal Balin, who's a wonderful guy, who's one of the best respected internists in San Francisco.
Mm-hmm.
And when he committed himself to acupuncture, he started studying with a woman named Miriam Lee, and then he went to England to study with a teacher named J.R. Worsley,
Right.
who
Yeah.
I
And
eventually
that's
went to study with.
what are the traditional school that was in.
Yeah, the five
Columbia.
element traditional school. He was his students founded that, and he
Yeah.
was a fabulous teacher.
Mm-hmm.
So Hal and I really hit it off. I really liked Hal, and I started to cover his practice when he would go to England to study with Worsley.
Mm-hmm.
And then he invited me in, so I set up my own practice in the city. I thought basically, I remember now. I thought it was time to see if a person, a doctor, could make a living doing this.
Yeah.
And that was a conscious experiment for me, because I was making my living doing emergency room medicine.
Mm-hmm.
I'd go down to Bakersfield or some town in the Central Valley. I'd spend 72 hours. I'd do emergency room medicine.
Mm-hmm.
I'd do that twice a month, and my time was my own, and I could study
Mhm.
acupuncture and imagery and psychology and nutrition
Mm-hmm.
and all that stuff. But when I moved into the city with Hal, I decided, if this is actually going to have an effect on the practice of medicine, which is always important to me, then I can talk about it. I don't know if you need that on. I can
No.
talk about it as much as, and I can educate people, I can write
Mhm.
about it, I can do research, but the thing that's going to have to happen is that a doctor's going to have to be able to make at least a decent
Mm-hmm.
living with it. Otherwise, it's just going to be a few guys around the fringes,
Mm-hmm.
and it's not going to become part of mainstream medicine.
Mm-hmm.
So that was a conscious experiment for me to see if I could make a living at it, and more or less I've made a living at it for 40 years
Mm-hmm.
with a lot of.
But you were in the city first with
In the
Hal?
city for two to 3 years, and then Hal had bought this ark, like
Mhm.
a houseboat out over the water in
Yeah,
Sausalito. It's
I
a
remember it,
historic
yeah.
ark from an artist named Gene Varda,
Mm-hmm.
and it was sort of a notorious Sausalito houseboat where they had all kinds of great art salons and parties and stuff.
Mm-hmm.
And so Hal's dream was to convert it into a home and an office,
Mm-hmm.
and so I encouraged him, and he did it. And we moved over there in '77. The ark was called the Omphale,
Right.
and we started what we call the Omphale Health Education Center. And we started to have Tuesday night lectures with people. You may well have done one. We probably invited you. We
No, I
should
don't
have.
think so.
People like Irving would talk, Mike Samuels would talk,
Mhm.
Fritjof Capra came over and
Mhm.
talked, Ken Pelletier talked, probably Stan Krippner.
Mm-hmm.
The people who are leading speakers and thinkers and writers
Mhm.
in the holistic world, we'd invite them. And people would come and bring potluck and sit in the rafters, and there'd be, 100 people there, and we'd just have these great discussions. And I went out for a few years, and then we would practice there too.
Well, yeah, I remember our staff started seeing Peggy because she was in there too.
Right, Peggy Arendt was in
Yeah.
there with us.
And
exactly
that's how I found out that you were over there.
And that's how we probably knew
We
you.
met, yeah. Mhm.
Yeah, I'm not.
And then I went off to Costa Rica, and next thing I know,
Right.
we're sharing that house over by the golf course, and you had a Cape Row, and I had a Cape Row, and
That's right.
you were writing, and
Because I had taken a sabbatical to write my first book.
Yeah.
I forgot that. We had
Yeah.
the Cape Pro computers.
I still have mine.
Do you really? That huge giant thing that was
Yeah.
so interesting to have. So I was writing my first book there,
Mm-hmm.
and then I saw some limited patients over there. And when I was done with that, which took about a year, I was involved with an organization called the Institute for Advancement of Health,
Mm-hmm.
which was founded by Eileen Rockefeller, now
Mhm.
Eileen Rockefeller Growald, son of John G. Rockefeller,
Mhm.
or son of David Rockefeller,
Mm-hmm.
daughter of David Rockefeller, who was highly influenced by Norman Cousins. And so she founded this organization called Institute for Advancement of Health, whose mission was to investigate and spread the word about mind-body medicine. She developed a very high-level boards and advisory
Mhm.
boards with Norman Cousins and Lewis Thomas from Sloan Kettering and Neil Miller, the father of biofeedback, and Robert Ader, who's basically the father of psychoneuroimmunology, Joel Estes, who's the father of psychopharmacology. I mean, incredible
Mm-hmm.
Nobel Prize-ish level people,
Mhm.
major figures in their fields. And then a couple of I felt like a rookie in that company, like me. Rachel Remen was part of
Mm-hmm.
it. Ken Pelletier, Michael Lerner was part of that.
The Commonwealth, Michael.
The Commonwealth,
yeah.
Michael Lerner. So that was very interesting. When I went back to practice, I really wanted to try to have a more expanded center than we could have at the Omphale. And
Well, somewhere in there, it's when you hooked up with David and started. the
David
institute.
Bressler.
Yeah.
Yeah. So
'Cause his name was bandied around a lot in the 70s
David
too.
was a very influential. David
Yeah.
Bressler was a very influential guy in the early holistic medicine. There was an early lecture circuit. David Bressler was usually there. David Sobel was usually on that circuit. Jim Fadiman
Mhm.
was a frequent speaker. Who was that Stanford physicist? Gay Luce was part of that. Carl and Stephanie Simonton both. So because Irving was kind of almost the band leader of that. He often functioned as the MC of those conferences. They were put on by UC Santa Cruz
Mm-hmm.
by a pretty visionary woman named Darla Chatema, who influenced a lot. So I got to know all those people, go to all those conferences.
Now Richard Miles was doing conferences.
Richard Miles
Was he part of that same?
Yes, I think
San
he was.
Andreas was the name they used.
They were related. They were
Uh-huh.
cross-fertilizing, I think, at that time. And Hal Kramer, who Richard worked
Oh, I
with.
forgot about him.
Yeah, who published Celestial
Mhm.
Arts and published so many people early on.
Mm-hmm.
So, where does it go from there? You were asking.
Well, yeah, how you met?
David
How
Breslin.
you and David got.
So
teamed
David,
up.
I always thought David was brilliant. He was he was about 30, 32, and he held academic positions at UCLA in psychology, anesthesiology, dental school.
Anesthesiology. He's a PhD though.
Yeah, he was a PhD neuroscientist.
Mm-hmm.
Got an appointment in anesthesiology with a guy named Ron Katz. He's a brilliant guy.
Mm-hmm.
And he also got an appointment in the dental school. And he started the UCLA Acupuncture Research Project, which
Mhm.
was probably the biggest research project of anyone ever did in acupuncture in the United States.
And they
Went
had a
on
pain
for 7
clinic.
or 8 years, had a pain clinic,
Yeah, that was.
did research on 25,000 chronic pain patients.
Mm.
They wrote lots of papers. And he was a great speaker. I always thought Dave was one of the most
Mm-hmm.
informative and entertaining speakers I ever met. And we got, and David was very taken with Irving Oil as
Mhm.
well. And we both got really turned on to Irving's use of guided imagery,
Mm-hmm.
especially the inner dialogue process and especially the inner advisor process, where
Which
somebody really
Mike Samuels had in the Body Book. Too.
exactly.
Yeah.
Mike was heavily influenced. So
Mhm.
was Elson Haas.
Mm-hmm.
But we really got taken with the inner advisor and the imagery part of
Mm-hmm.
it. And we became very good friends as well because we had this interest in acupuncture and we just hit it off very well. So as I got deeper into imagery, I found psychosynthesis,
Mm-hmm.
which was developed by Roberto Saggioli,
Mhm.
contemporary of Jung and Freud's and Italian psychiatrist who believed that, yes, a great deal of what motivates us in our lives is unconscious, but the unconscious was not just a repository of bad, dirty things. It was also very often our highest attributes
Mhm.
were also repressed and unconscious.
Mm-hmm.
And he used a great deal of imagery to access the unconscious contents and what he called subpersonalities, different parts of ourselves that might feel or react differently
Mhm.
about different things in our lives.
I'm concerned about the time.
Okay, what
Just,
time is it? We got 5 minutes.
Oh, okay.
And he's worth talking about. So I did psychosynthesis training at the Psychosynthesis Institute in San Francisco. Rachel Remen also trained
Right,
at that
and
time.
Bob Belknap was involved in that? Or?
Bob's wife at that
That
time
was
was
it, yeah.
involved. Yeah,
Mhm.
that institute had a sad end. It was such a wonderful, wonderful place, and it turned into a cult.
Mm.
And about half the faculty kind of ran away with the guy who was leading it, and Bob's wife was one of them and
Oh.
left the family.
Mm.
They literally, it was one of those cult disappearances.
Mm.
They left and nobody ever heard from them. But,
Hmm.
you know,
Now was Don Fink,
no, Don Fink
What
wasn't
was-
part of that.
but I mean he was one of the few MDs I remember that was at least sympathetic to holistic.
Very
stuff.
sympathetic.
Yeah,
yeah.
and he was down at
But I don't think he
San
was
Francisco
into.
General.
Yeah.
No, he wasn't
Yeah.
psychosynthesis. I was just.
To me, he
kinda-
was. Yeah, Don Fink was very much interested in the holistic movement.
I got to track him down too. I haven't seen him for 35
I
years.
don't remember much of that. Anyhow, to finish the story,
Mhm.
the involvement in imagery is what got Bressler
Mhm.
and acupuncture got us together. And in '78, I went to a conference on imagery in Chicago that was put on by Anish Sheikh, who's a professor of psychology at Marquette University and was
Mhm.
deep into imagery and in an academic sense.
Mhm.
And he put a very nice conference together, bringing together a whole bunch of people that I didn't know had been interested in imagery for learning, for psychology, for healing, for therapy for a long time. And mostly Eastern academics. And that was very, very exciting. And then I worked with him to put together a conference we called The Power of Imagination.
Mhm.
And we held it in San Francisco at the Palace of Fine Arts in
Mm.
1978. We had about 800 people there. and Bresler came to speak, and some Jerry Singer, who's very prominent with imagery and education, a guy named Julian James, who's a
Oh,
Princeton
yeah, the
professor,
bicameral mind.
the bicameral mind. So we're really starting to think about how the imagery worked in that way. And that was a big hit, that conference, and we took it on the road, and we did it about 12 to 14 times around the country. And then people started to ask us for clinical training. And David and I were really the only two people that were doing clinical work. Most of the others were research and academicians. So he and I put together a curriculum for a workshop for imagery, and that was very popular. And then we put together some advanced workshops, and that started to get popular. And then people were calling us and who for referrals, and we decided that, how can we really, this is very, very powerful work. It goes deep very fast, the imagery, and you have to know how to handle it, especially if you're working with people with significant trauma or significant wounds. And the basic question we asked ourselves was, what kind of training would we need to give people in order to be able to refer somebody to them? Because we both took referrals very seriously, still do. If I refer somebody to somebody, they better know what they're doing, be trustworthy and ethical. So we put together this 150-hour curriculum. We founded the Academy for Guided Imagery as a postgraduate training institute. And we traveled around doing that for quite a while. We had about 800 health professionals certified in what we came to call interactive guided imagery. We had about 10,000 health professionals take workshops with us. We wrote about imagery and were involved with, and the imagery is still, to me, getting back to that question of how do you help people change, it's still probably the most powerful tool that I've got. So I've written 3 popular books about it. I've written a bunch of medical textbooks on it, and more and more people, I think, know about it now, but more people will know about it as it comes on. I think it's the currency of the mind-body connection, basically. It's just
Now, is the Academy still functioning?
The Academy still exists. David is the president. I resigned about 5-6 years ago. So he's the president, and there's a website, ACADGI, ACADGI.
And he did that virtual conference a few years ago.
Yeah, that was
and then he was going to do a second one, but something happened. It didn't come off.
I don't know the details about that. David is also a visionary, and the plight of the visionary, which you know very well, is that it's not really any better in terms of, to be ahead of your time than it is to be behind your times. It's fun, and it's and there's a certain personality type that I think does it and kind of, introduces people to concepts that are new to them, and has the passion for it and believes in it, knows that it works, and is just determined to pass it on because it's your wellness, the work that you did in wellness. But when you look at making a living,
the money's still in sick care.
Exactly. It's always been hard, to sell wellness. It's hard to sell work on yourself. It's hard to sell change yourself. But when that time comes for a person, when they're ready to do that, there are certain tools that just make that much more accessible and much easier and much more effective.
So what your practice now is, you have a staff of 3. I heard on the answering machine, and so I saw 4 plaques on the door.
Yeah, exactly. I have a wonderful nutritionist that works for me, a woman who's
mind-body therapist.
Pat Morgan has a master's in dance and movement therapy, and she's just a fantastic, we call her a mind-body worker, and she's great with craniosacral work, manual therapy, and interweaving the interactive guided imagery with it. She was the head of our faculty at the Academy for quite a number of years. A really wonderful healer.
So you have...
So I'm there 4 days a week, Monday through Thursday, and they're there on Friday, and they use other times. So it's a small clinic, so we don't have time.
And so you're still sticking needles in people? And
I am. I do a lot of acupuncture. It's still, I'm a very fast learner. I always was a fast learner. School was always very easy for
Mhm.
me. I had a reputation about that. I was lucky that way. And so, as fast learners go, one of the downsides of being a fast learner is you get bored pretty quickly. You don't like doing the same thing over and over.
Yeah.
After 40 years, and I don't know how many, I figured it out sometimes. I don't know if it's 100,000 or 200,000 acupuncture treatments I've done in people.
Wow.
I am blown away on a daily basis. I'm always surprised when it works. You know, it works more often than it doesn't.
Mm-hmm.
And I scratch my head every day, and I'm so grateful for that, that it keeps me thinking about it. It keeps me amazed. It keeps me kind of humble, you know, in the face of what life can do
Mhm.
and what life can overcome at times. It's just been a great blessing in my.
Just hold for a minute. We'll cut this. Good timing. I'll just edit this piece out. Can you remember what you were saying just before?
I think we were talking about my clinic, weren't we?
Yeah, but can you pick up the same sentence or?
Not from memory.
Okay, well, we'll just try to cut that. So, what's your vision for
I was
the
talking
rest?
about how I'm still blown away
Yeah,
by acupuncture and imagery on a daily basis.
Do you envision doing this for another 20, 30 years? Is that something new on the horizon?
I
or-
don't think I'll be around that long, actually. But
Why
but
not?
I'd like to practice. I'd like to keep my hand in practice,
Mhm.
probably as long as I'm alive and well.
Mhm.
I love it, and I'm good at it, and but probably not as much as I'm doing.
Mhm.
So I'd like to, and I'm starting to move back towards teaching and speaking.
Mhm.
I've still been doing writing. You know, I've produced a lot of instructional material for
Mhm.
both for self-care and guided imagery through my company, The Healing Mind.
Mhm.
And
These dogs are snoring too loud. Where are they? Where's the one that's
There.
making all the
the
noise?
one in the back of the clinic. So I'd like to be able to spread the word. I'd like to be able to
Mhm.
teach more. I teach medical students from UC San Francisco come over. I'd like to be able to influence more young doctors
Mhm.
and just let people know that they've got, you know, the human imagination is it's what distinguishes us from all the other animals. And it's absolutely powerful, and if you don't learn how to use it, it can drive you crazy.
Yeah,
and it can make you
it's
sick.
working whether
It's
you're
working
in
whether
charge
you're
of it or not.
whether you're using it or not. That's
Yeah.
basically it, and
Yeah.
it's so close to what really makes us special
Yeah.
as humans, and it's also the organ. It's the mental organ that's either going to save us or destroy us,
Yeah.
and the rest of the world around us. All the things that are right now threatening to destroy the world: nuclear power, pollution, climate change, racial hatred. These are all products of the imagination. And I'm just hoping that we're wise enough and that we learn how to use our intelligence quickly enough so that we, as Rachel says, you know, that we become wise enough, fast enough to be able to use these brilliant things that have been invented,
Mhm.
but that we may not be wise enough to handle in a
Mhm.
sustainable way. So
Mhm.
I'd still like to contribute to that, and hope I'll be able to do that. Latest project is getting guided imagery audios into hospitals
Mm.
so that patients in their bed can tune into relaxation.
Finally,
pain
I've been
relief.
wanting to see that for 30
Well,
years.
it's in Marin General Hospital.
Good.
Just got it in this year, and we're just starting to collect some usage and effectiveness data. And once I get that, I'm gonna go out to other places and try to spread it around.
Well, it's been great talking to you.
And great talking to you. Our timing is good. Thank you very much.
And here's my daughter, Hannah.
Hi.
Thanks for this useful
Picking up my
advice.
don't know why these are on the ground from the kids.